Imagine this. You're going about your day feeling slightly off. Maybe it's a little chest discomfort or a sense of fatigue that seems out of the ordinary. You shrug it off, thinking it's nothing serious. But what if those small, subtle signs are your body trying to warn you about something life-threatening, a heart attack? Today we'll dive deep into the early symptoms of a heart attack, breaking them down step by step, so you can recognize the signs and act before it's too late. Let's start with the most common and well-known symptom: chest discomfort. Many people assume that a heart attack will cause sudden, intense chest pain like you see in movies. But in reality, it's often more subtle. You might feel pressure, tightness, or a squeezing sensation in the center of your chest. It might feel like something heavy is pressing down on you. This discomfort can last for several minutes or come and go. While it's easy to mistake this for heartburn or muscle strain, never ignore chest pain. It's the most common warning sign of a heart attack. Heart attack pain isn't always confined to the chest. It can spread to other areas, including your arms, shoulders, neck, jaw, and even your back. Pain in the left arm is especially common, but it's important to know that pain can also occur in the right arm. Jaw or neck pain might be mistaken for dental issues, and back pain can feel like a pulled muscle. These symptoms, known as referred pain, happen because the heart shares nerve pathways with these parts of the body. If you notice pain in any of these areas that doesn't seem normal, it could be a red flag. Next up is shortness of breath. This symptom might occur alongside chest pain, or it could happen on its own. You might find yourself struggling to catch your breath while doing something as simple as climbing stairs or walking to the mailbox. In some cases, shortness of breath happens even while you're resting. This occurs because the heart isn't pumping blood effectively, leading to a buildup of fluid in the lungs. If you're feeling winded for no obvious reason, it's time to pay attention. Sometimes a heart attack doesn't feel like a heart problem at all. You might experience nausea, vomiting, or even a burning sensation that feels like indigestion or heartburn. This is especially common in women, and it's often overlooked or dismissed as a stomach issue. The reduced blood flow to the stomach or stimulation of the vagus nerve during a heart attack can create these gastrointestinal symptoms. If you're feeling queasy and it's paired with other symptoms, don't ignore it. Unusual fatigue is another symptom that often flies under the radar. Imagine feeling drained of energy for no clear reason, even after a good night's sleep. You might feel like simple tasks, such as walking across the room or carrying groceries, are unusually tiring. This extreme fatigue is often an early warning sign, particularly in women. It happens because the heart is working harder to pump blood, leaving your body feeling exhausted. If you notice this kind of fatigue, especially in combination with other symptoms, take it seriously. Breaking out into a cold sweat is another common warning sign. It might feel like you're sweating heavily without any physical activity or a hot environment to explain it. Your skin might also feel clammy or damp. This happens because your body is reacting to stress and lack of oxygen by activating sweat glands. If this happens suddenly and without explanation, it's time to seek help. Dizziness or lightheadedness is another symptom to watch out for. You might feel faint, unsteady, or even close to blacking out. This can happen because a heart attack reduces blood pressure, cutting off oxygen supply to the brain. If you feel this way, especially alongside other symptoms, it's a clear sign something is wrong. Heart palpitations or an irregular heartbeat can also be a sign. You might feel like your heart is racing, fluttering, or skipping beats. These sensations can be alarming, and they often come with anxiety or shortness of breath. Disrupted electrical signals in the heart during an attack can lead to these arrhythmias. Don't ignore persistent or unusual changes in your heartbeat. Swelling in the legs, feet, or abdomen can be another sign of heart trouble. You might notice your shoes feeling tighter, or you may see puffiness in these areas. This happens because the heart's reduced pumping ability causes fluid to build up in the body. While swelling can have many causes, it's worth checking out if it occurs with other symptoms. Finally, some people experience a sense of impending doom, an overwhelming feeling that something is very wrong. While this might sound dramatic, it's a real and serious symptom. It's your body's way of alerting you that it's in distress. If you ever feel this way, don't dismiss it. Heart attacks are a leading cause of death worldwide, but the good news is that early recognition of these symptoms can save lives. If you or someone you know experiences any of these signs, don't wait. Call emergency services immediately. Chew an aspirin if it's safe to do so. And rest until help arrives. Remember, Acting quickly can mean the difference between life and death. Stay heart smart. Share this knowledge and take care of your heart. It's the engine that keeps you going.